Well, shortages of nurses are well documented. Hospitals are shelling out more cash to pay higher premiums for clinical staff from agencies. But many are dealing with other labor shortages that are even harder to fill. Brock Turner has the story.
It's easier now for Crystal Jeffries to look back on the impact COVID-19 has had on her and her team at Columbus Regional Hospital.
Oh my goodness, the first time I heard about COVID was on the news, and it was hitting China. And I thought, that's never going to reach here. But sure enough, it did. And it got here quick.
And in other news, an outbreak of viral pneumonia in China has spread to the United States. Federal health officials confirmed a Seattle area man brought the virus back from central China.
What would follow was well documented. Hospitals across Indiana and the nation endured short staffs, in part due to quarantines and the new demands of working in healthcare during a global pandemic.
We've had a lot of turnover because people are frightened to come in here and work.
Her environmental services coworker, Denise Hodnett, agrees.
The last year has been hectic. I mean, our workload has been like double, if not more.
Jeffries says those effects are still present, but aren't always justified, at least from her perspective.
They shouldn't be. We use our precautions. You know, we're safe.
Those precautions include consistent masking, donning a full ensemble of personal protective equipment when entering infected patient areas, and vaccines. Many experts say those changing procedures have led workers to seek employment elsewhere, not vaccine mandates.
How it's affected the work environment, how it's changed the stress level of jobs. I think that's probably a bigger picture reason than the vaccine requirements themselves.
But not everyone agrees.
I do, yes. I do, because everybody has their own outlook on things. So yes, I do. I think that has a whole lot to do with it.
Chris Wood, who manages the team, says all of our staff members have either been vaccinated or applied for an exemption.
That's something that we do ask a potential new hire, their feelings on it.
Around 1/3 of Wood's staff either recently started or still needs to be hired. And while similar labor challenges are present throughout the economy, the prerequisites in hospitals are unique. Brad Smith is the CEO at Rush Memorial Hospital in Rushville.
During the pandemic, we really had to take a step back and reevaluate their wages. And we accelerated their wages a couple times during the pandemic just to make sure that we could keep that turnover really low.
While the shortages of nurses, doctors, and physical space dominated much of the conversation, behind the scenes, other staffing shortages were present. Smith says his greatest challenge is hiring non-clinical staff because the competition for those employees is so great.
When it comes to EVS or other non-clinical positions, we might lose that position to, like I said, the courthouse or the school systems, or maybe even the nearest Amazon distribution center. That's where we lose those positions too.
Environmental service staff are responsible for cleaning and transitioning patient rooms. In many hospitals, they'll spend as much time with patients as doctors and nurses. And as you can imagine, COVID-19 upended long-established protocols.
We have one floor that's set up for COVID, and then we have other floors that has COVID patients. But the next patient may not be COVID.
That's a setup Jeffries knows well. Gretchen Smith, the VP of Operations at Rush Memorial Hospital, says those challenges are widespread. Her EVS staff more than tripled during COVID's peak, absorbing employees from other service lines to deal with all the increased cleaning.
It was exhausting for those staff. I mean, it would be nothing for them to clean, 20 rooms a day. And being a small critical access hospital, that's quite a bit for our staff. There has definitely been a new focus, a new light put on environmental services. The importance of their role is crucial. And I think that has been brought to the forefront more so than ever during this pandemic.
Despite all of the changes and challenges, neither Jeffries nor her coworkers say they ever thought about leaving the hospital and finding work elsewhere. They say the service and desire to help their community keeps them cleaning. For Indiana News Desk, I'm Brock Turner.